of the most common questions I get every day is, why would I buy a drug plan? Why do I need Medicare Part D if I'm not using it anyway? I'm not on any drugs right now. Or I want a couple cheap drugs, but I get them from Mark Cuban's low-cost pharmacy, or I get them from GoodRx, the discount card, or Single Care, or all the other discount cards. Why do I need to buy insurance too? And the reason is because insurance is for the big stuff. And we don't learn about insurance in school. So most people, they don't really understand the concept of insurance is for the big stuff. They're mad when it doesn't cover your little cheap $5 lisinopril. No, we don't care about your lisinopril. We don't care about your cheap drugs. We care about you getting cancer or Parkinson's or something very, very expensive. And that's when these drug discount cards are going to help you. You're going to need help from the private insurance and from the federal government for the big stuff. Think about it like this. Think about your house insurance. You pay insurance premiums every month. You pay them for your whole life. Most people have never had a house claim. Most people have never had their house burned down or a tornado hit it or a hailstorm take off the roof. They just paid it. And if they had little stuff, they didn't care. They paid for those. They never turned that in because either they had a $1,000 deductible or they just didn't want to drive their rates up. So they always paid it. But you kept your insurance for the big stuff. The big stuff is the tornado, is the wildfire. So you got to think about your insurance this way. Sure, you can get it through GoodRx. But let's say Eliquis, one of the most expensive drugs in the country, which is a blood thinner. Eliquis, even with GoodRx, is still $500 a month, okay? If you use a discount card, that means you are not using the drug, the infrastructure of the Medicare Part D drug plan, which means you have a deductible, which may or may not apply. You have copays, then you pay it 25% in the thing that's not called the donut hole. And after you hit a certain limit, then the rest of your drugs for the rest of the year are covered. So if you're taking a lot of expensive drugs, but you're using these discount cards, you're not hitting these thresholds. You're never getting to the part where the rest of your drugs are covered for free, no copay for you for the rest of the year. So I'm not against taking the drug discount cards, but if you don't also have in your pocket a Medicare Part D plan and you call me, now let's say you call me in April. I used to call that the crying month because I would have people literally crying on the phone all the time in April. It used to be because they were hitting their donut hole, but since the Biden administration says we don't have a donut hole, but we do, I still get people upset in April. You get a bad diagnosis and you're now required to buy a drug that costs $13,000 a month. Yes, there's a lot of drugs that are that expensive. You can't believe they're that expensive until you get that unfortunate diagnosis. You're like, what now? Because these drug discount cards aren't going to touch those drugs. Now you're going to use your Medicare Part D that you haven't have a claim and you didn't care. But if something bad happens, the tornado, the hurricane, the wildfire, you're going to want coverage today. If you don't have Medicare Part D coverage today and you get the bad diagnosis, you can call us and the Medicare Family. We can help you. But we can't help you get drug coverage until the next period where it's allowed. The general election period is the first quarter of the year, January, February, and March. So you call me in April, we got to wait till next January to get you enrolled into a drug program. Okay, so we got a long wait there. And during that period, like I said, the drug discount cards aren't going to help you with your drugs. So I'd much prefer that you have, just buy low cost. There is a very low cost drug plan in almost all states, under $10. Buy it. You can afford $10 a month for a plan you do not use. And I hope you never use it. That's my wish for you, that you just waste that $10 a month. But if you do get sick, you have insurance today. You don't have to wait. Now, waiting is a problem, but you also have the penalty to contend with. So if we have to wait until we can get you back in, then we'll also have to calculate your penalty. And your penalty is 1% times the average national premium times the number of months you were late. So if you didn't have a drug plan for 5 years, you will have to pay that huge premium. So this was, let's say the national price in 2024 is $54 a month. So take how many months you were late. So if you're 60 months late, times 1%, times the national price of Part D equals your penalty. So you also have to pay that for the rest of your life. The problem is this penalty never goes away. It is a lifetime penalty. So 1, I'd like you to avoid the penalty. 2, I'd like you to avoid the waiting period if you get sick. What is the answer to all of this? It is to have a plan just by using drug discount cards. But you also have it as a backup, which is what insurance is. Insurance is there for the big stuff if you do need it. If you need Medicare Part D, our company, the Medicare Family, we can help you. We are licensed in all 50 states, or you can go to our website, just book your own appointment at themedicarefamily.com. Top of the page is a little yellow box, book your appointment. It'll say, what do you need help with? Do you need help with a Medicare supplement, Medicare Advantage, dental plans, cancer plans, Medicare Part D? So click the box, tell us when to call you. We will then call you. We'll only call you. We only call people that ask us to call you, and have a list of your drugs and your dosages ready, and we'll search and help you find a Medicare Part D drug plan. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.